Leave nothing to chance. This is the story of Anu Varghese, one among the many healthcare workers like you, who spend their lives bringing smiles on the faces of millions of patients. Anu Varghese's story.
ഡിസംബർ 1998 എൻ്റെ കല്യാണ നിശ്ചയമായിരുന്നു. ഞാൻ സ്വപ്നത്തിൽ കണ്ടതുപോലെയുള്ള ഒരു പുരുഷനെ കിട്ടിയതിൽ ഞാൻ വളരെയധികം സന്തോഷിച്ചു. ജോജി, എൻ്റെ വുഡ് ബി, വളരെ നല്ല മനുഷ്യനായിരുന്നു. അദ്ദേഹത്തിന് ദുബായിൽ നല്ല ജോലിയുണ്ടായിരുന്നു. വിവാഹത്തിനു ശേഷം എന്നെ കൂടെ കൊണ്ടുപോകാമെന്നായിരുന്നു പറഞ്ഞത്. എനിക്ക് വേണ്ടി ഏറ്റവും അധികം സന്തോഷിച്ചത് എൻ്റെ പപ്പയും മമ്മിയുമായിരുന്നു. ആ ദിവസത്തിനു വേണ്ടി ഞാൻ വളരെ പ്രതീക്ഷയോടെ കാത്തിരുന്നു. ആ 45 ദിവസങ്ങൾ എൻ്റെ ജീവിതത്തിൻ്റെ ഏറ്റവും സന്തോഷം നിറഞ്ഞ ദിവസങ്ങളായിരുന്നു. ജനുവരി 29 ഞാൻ പതിവ് പോലെ ഹോസ്പിറ്റലിലെത്തി. കല്യാണത്തിന് ഇനി 9 ദിവസങ്ങൾ മാത്രം. എൻ്റെ ഫ്രണ്ട്സ് എനിക്ക് വേണ്ടി വളരെയധികം സന്തോഷിച്ചു. അവർ ഹണിമൂൺ പ്ലാൻ ചെയ്തു തുടങ്ങിയിരുന്നു. എനിക്ക് മുന്നാറിൽ പോകാനായിരുന്നു ഇഷ്ടം, പക്ഷെ ജോജിക്ക് ബീച്ചിൽ പോകാനായിരുന്നു താല്പര്യം. ഞങ്ങൾ കോവളമോ അല്ലെങ്കിൽ ഗോവയിലോ പോകണമെന്ന് തീരുമാനിച്ചു. എനിക്കിന്നും ഓർമ്മയുണ്ട്, ഞാൻ ലീവിൽ പോകുന്നതിനു മുമ്പ് ഹോസ്പിറ്റലിൽ അവസാനത്തെ ദിവസമായിരുന്നു. മേട്രൻ എന്നെ മുറിയിൽ വിളിച്ചു. ഞാൻ സന്തോഷത്തോടെ ഓടിയെത്തി. എനിക്ക് ആശംസകൾ നൽകാനായിരിക്കും. അകത്തേക്ക് ചെന്നപ്പോൾ എനിക്ക് സംശയം തോന്നി. മേട്രൻ വളരെ സങ്കടപ്പെട്ടിരിക്കുകയായിരുന്നു. എനിക്ക് കാരണം മനസ്സിലായില്ല. ഒന്നും മിണ്ടാതെ അവർ എനിക്ക് ഒരു കവർ തന്നു. ഞാൻ അതിശയിച്ചു. ആ കടലാസ് തുറന്നു നോക്കിയപ്പോൾ എനിക്ക് വിശ്വാസമായില്ല. എൻ്റെ ഡെത്ത് വാറൻ്റ് ആയിരുന്നു. സാത്താൻ്റെ നരകത്തിൽ നിന്നുള്ള കത്ത്. എൻ്റെ ബ്ലഡ് ടെസ്റ്റ് റിപ്പോർട്ട്, അത് HIV പോസിറ്റീവ് ആയിരുന്നു. എൻ്റെ ജീവിതം എൻ്റെ മുമ്പിൽ തന്നെ തകരുന്നതായി ഞാൻ കണ്ടു. ഞാൻ മേട്ടനോട് ചോദിച്ചു, ഇതെങ്ങനെ സാധ്യമാണ്? ഞാൻ 2 മാസം മുമ്പ് ചെയ്ത ടെസ്റ്റ് നെഗറ്റീവ് ആയിരുന്നല്ലോ. മേട്ടൻ പറഞ്ഞു, ഇത് എയ്ഡ്സ് വൈറസിനുള്ള ഒരു പ്രത്യേകതയാണ്. അത് എപ്പോൾ വേണമെങ്കിൽ ആക്രമിക്കാം. ഒരു നീഡിൽ സ്റ്റിക്ക് ഇഞ്ചുറി എൻ്റെ ജീവിതം തകർത്തു. ജോജിയുടെ വിവാഹം കഴിഞ്ഞു, മറ്റൊരു സ്ത്രീയുമായി. എൻ്റെ പപ്പയ്ക്ക് ഈ ദുഃഖം താങ്ങാനായില്ല. ഹാർട്ട് അറ്റാക്ക് വന്ന് മരിച്ചു. പാവം മമ്മി. ഞാനോ, എനിക്കിപ്പോൾ ജോലിയില്ല, ഒരു കാത്തിരിപ്പ് മാത്രം. മരണത്തിൻ്റെ വിളി കാത്ത്. എൻ്റെ അന്ത്യം നിശ്ചിതമാണ്, പക്ഷെ മറ്റാരും ഈ നരകം അനുഭവിക്കരുതെന്ന് എനിക്ക് ആഗ്രഹമുണ്ട്. എനിക്ക് നിങ്ങൾ എല്ലാവരോടും ഒരു കാര്യമേ പറയാനുള്ളൂ. സൂചിയോ സിറിഞ്ചോ അല്ലെങ്കിൽ ഏത് മൂർച്ചയുള്ള ഉപകരണങ്ങളോ ഉപയോഗിക്കുമ്പോൾ വളരെയധികം ശ്രദ്ധിക്കണം.
A needle that saves life can take your life too. There could be thousands of healthcare workers living with AIDS and other life-threatening diseases.
दिल्ली के मरीज अस्पताल के शिकार नहीं हुए हैं। यहाँ की नर्सों पर भी उतना ही खतरा है। शहर की 8 नर्सों को एड्स हो चुका है। ये सभी सरकारी सीजीएचएस डिस्पेंसरी की नर्सें हैं। ये नर्स मरीजों की खिदमत में अपना जीवन गुजारना चाहती थी। राजधानी दिल्ली के एक मशहूर विश्वविद्यालय की डिस्पेंसरी में से नौकरी भी मिल गई, लेकिन ये नौकरी इसे इतनी महंगी पड़ेगी इसका अंदाजा इसे नहीं था। एक छोटी सी गलती से उसे एड्स हो गया।
ये सब कुछ एक एक्सीडेंट था। जब मैं एक एचआईवी पेशेंट को इंजेक्शन दे रही थी, उसी वक्त नीडल टूट गई और मेरे अंदर एचआईवी वायरस आ गया। डॉक्टर ने मुझे सतर्क रहने को कहा था।
राजधानी दिल्ली में ऐसे 8 मामले सामने आए हैं जिसमें नर्सों को एड्स हो गया है।
जिन लोगों को बीमारी की रोकथाम का जिम्मा दिया गया है उन्हें ही ये बीमारी लग जा रही है।
In fact, I reported a case of ballistic injury in a nursing staff, and she acquired HIV infection following the needle stick injury. The risk of HIV infection through needle stick injury is around 3 per 1000, but the risk of acquiring hepatitis B infection through these needle stick injury is very high. The young doctors, particularly the postgraduate trainee, the nursing staff, they get the infection or injuries during collection of blood and during removal of the intravenous channel. Quantity of blood requires for transmission of infection varies from different diseases. In fact, in case of hepatitis B, particularly from the super carriers, 0.00004 milliliter of blood is enough, or even the tissue fluid is enough to cause hepatitis B infection.
More than 20 odd pathogens can be transmitted via needle stick injury. Hollow bore blood-filled needles pose the highest risk of infection.
Journal of Hospital Infection, we published 380 cases. Over there we have demonstrated, and now we have got total 588 cases. And in this cross section, if you take of the staff affected, 48% are the nurses and 13% are the doctors, 10% are the technicians, and 29% are the housekeeping staff suffering from this.
World Health Organization has estimated the incidence of needle stick injuries at about 30 injuries per 100 beds per year.
Hepatitis B, hepatitis C, your AIDS, and we have seen the doctors getting affected, because I personally know number of my doctor friends who are contaminated with hepatitis B or hepatitis C permanently. One cannot just neglect it. One should try to avail every kind of protection against it.
Be it anesthetists, postgraduate doctors, nurses, laboratory technicians, ward boys, housekeeping, everyone working in a hospital setting is at risk of needle stick injuries. Don't be casual about needle stick injuries. Losing a drop of blood won't kill you. Receiving it can. Think about it.
Relax. Needle stick injuries can be devastating. However, there are simple rules which if followed can definitely help to save a patient or your life.
4 golden rules to save your life. Report all needle stick injuries.
The first rule, report every needle stick injury. However small the NSI may be, you need to report it to your senior colleague immediately. This stitch in time could save you your life.
Be active and get vaccinated.
The second rule is be active and get vaccinated. This active step on your part could prevent infection by hepatitis B virus. Hepatitis B vaccination is mandatory for all healthcare workers. Insist on getting vaccinated against hepatitis B.
Universal precaution for all patients.
Consider all patients as high risk. Irrespective of their socioeconomic class or the class of admission in the hospital, each and every patient must be considered as potentially infectious. Every blood and body fluid sample must be considered as infectious and be treated using universal precautions.
Use passive safety devices if provided by your employer.
Use passive safety devices like Vasofix Safety if provided. Today, hospital management is becoming more alert and choosing safety devices with passive safety mechanism. In case your hospital has chosen such a device, insist on the usage of the same. Never take any chances.
Vasofix Safety and Introcan Safety. The first choice for safety IVC in India.
I have been using the Vasofix Safety of Bibron right from the day one that they had brought to my hospital, and I compliment them very heavily because this is a definite total prevention of having any kind of cross infection between an infected patient and the doctor, the nurse, the ward boy, the sweeper, for that matter anybody even in the street corner can come in contact with the callously thrown the stylet. Once a doctor decides or a nurse decides to go inside a vein, one must use the protective needles so that he cannot get the needle stick injury from the stylet of the cannula.
Well, accidents are accident, but we can avoid it, and in fact it has been observed that 88% of the needle stick injury could be avoided by use of safety measures. And in India today we have the passive safety devices available freely in the market, and I think the use of the safety device should be followed universally by the medical and paramedical persons.
At Wockhardt, we do take care of our patients and there is enough patient safety, but at the same time the healthcare workers are also important to us. We have the latest equipment and latest technology to combat needle stick injury at Wockhardt hospitals.
At AIMS, we believe that taking care of the patients is not our only responsibility, and the safety of our staff is equally important. Our duty is to ensure that we provide them with highest levels of safety in their working environment, and preventing needle stick injuries is definitely one of the first in the list. That is why we use appropriate safety devices and preventive measures in our hospital.
In July 2004, we introduced the safety devices. We first introduced in the very selected cases, and slowly we are taking more and more safety devices, and it is really reduced 2006 we had only 7 cases of the needle stick injury due to IV line administration.
JCI accreditation, it works towards patient and healthcare workers' safety. We at Apollo ensure maximum safety for all our healthcare workers.
We at B. Brown contribute to the prevention of the spread of highly communicable diseases such as HIV, hepatitis B and hepatitis C by inventing such medical devices as the Vasofix Safety to ensure the highest level of safety in hospitals. We are committed to safety, your safety. This is our way of telling the world we care.
We prefer developing products which do not require any change in the prevailing techniques which are being used in the hospitals. We want to make a positive difference in the life of each and every healthcare provider in our customers. Today, we are proud to say that due to our persistent efforts, all the major hospitals in India have started using safety devices, and we will not rest until the safety movement reaches each and every hospital in India and touches the life of the healthcare provider at every corner of the country.
B. Brown with the safety initiative will go a long way in working closer with you to offer better healthcare facilities to the community. Due to your support, so far we have succeeded in preventing more than 2 million needle stick injuries. To save many more lives, we need your support. For this, we invite you to join this movement called Mission Safety. Be a part of Mission Safety and always use B. Brown Safety Cannula.
Mission Safety. You care for patients. We care for you. Be safe.
Be safe. That's what I would suggest to all of my colleagues in healthcare.
So be safe to all healthcare workers.
Be safe.
Be safe with B. Brown.
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 Leave nothing to chance. Be safe with B. Brown.
Be safe with B. Brown.
Be a part of this mission and be safe. Be Brown, sharing expertise. Be safe. Leave nothing to chance. This demonstration will show you how to insert an IV catheter using B. Brown's Vasofix Safety IV catheter. Although we are using a B. Brown safety device for the procedure, you will observe that there is no change in technique compared to standard non-safety cannulae. Demonstration of IV cannulation procedure. Most patients undergo IV cannulation at some point of their life, but with a lot of fear and apprehension. Step 1. Greet the patient and explain the procedure. It is therefore mandatory on the part of the nursing personnel to greet the patient and explain the purpose of the infusion and the steps involved in the procedure. IV cannulation is best achieved with the patient lying down. If this is not possible, then at least in a sitting position with arms stretched out, supported at the elbow. Ensure that all equipments needed for the vein puncture are prepared in advance, since prolonged obstruction of the blood flow may be painful and can also cause hematoma. Necessary for the vein puncture are a tourniquet, disinfectant, gauze pads, 2 or 3 IV cannulae of various sizes, and if no infusion is being prepared, the corresponding stylet, fixation plaster and gloves. Good lighting is essential. Step 2. Correct vein assessment and applying the tourniquet. Inspect the patient's arm and hand, looking for a vein that fulfills 3 basic criteria: is clearly visible, can be palpated, has a straight section for entry. Correct vein assessment and site selection is imperative to IV therapy. Appropriate site selection will determine whether the outcome of your infusion therapy will be successful or one full of complications. Apply a tourniquet about 3 inches above the intended cannulation site to make the vein more visible. Step 3. Hand washing and wearing gloves. Wash your hands thoroughly with antiseptic hand wash and dry thoroughly. Use standard hand washing techniques. Don clean disposable gloves. Step 4. Disinfection of the site. Vigorously cleanse the proposed site with an alcohol swab, or as per the hospital protocols, in a circular manner from center to outside, and allow it to dry for 30 to 60 seconds. Step 5. Selecting the appropriate gauge size. Select the appropriate, smallest gauge size granule for the patient's vasculature and intended therapy. Taking into account the vein size, patient's fluid requirements, and the duration of the therapy. Step 6. Insertion. The IV cannula is held with the thumb and forefinger for venipuncture. Insert the cannula at an angle of approximately 30 to 45 degrees along the axis of the vein. The ring finger and the little finger can be used to provide support. Puncture is made with a vigorous thrust. You may feel a slight resistance and then a release as the needle enters the vein. Observe the backflow of blood in the flashback chamber, indicating that the stylet has entered the vein. Lower the angle of the cannula to approximately 10 degrees or nearly parallel with the skin. Advance the catheter. This will ensure that the needle and catheter have fully entered the vein. The tourniquet may now be removed. The steel needle initially remains inside the catheter. This prevents the escape of blood and stabilizes the catheter. To withdraw the steel needle, one finger feels for the tip of the catheter and the middle finger applies pressure on the injection port, called as the V technique, while the needle is withdrawn parallel to the patient's skin.
As the
stylet is withdrawn, you may feel a slight resistance as it passes through the safety clip.
You may hear an audible click
as the safety clip attaches and covers the stylet automatically.
Although this is a safety
device, it needs to be immediately discarded in a sharps container.
and regulate the flow of
Attach
the
the
IV solution,
transfusion
according to
accessories
physician's orders,
as per the
promptly
clinician's
to prevent
instructions
the patient's
or
blood
hospital
from clotting
protocols.
and occluding the catheter.
The IV cannula should now be fixated as per the hospital protocols so that it cannot be pulled out by mistake, will not kink as a result of movements of the arm, and there will be no mechanical irritation of the vein. There are various methods and materials used for catheter fixation. The simplest is a transparent plaster with a single slit. Fixation with 4 plaster strips is more stable. An alternative is the crisscross fixation. Step 7. Document the procedure. Remove and discard your gloves. Document the procedure in the patient's records for future reference. The following initial hitches may be encountered by some of the clinicians using safety devices for the very first time. Let's find out how do we address these issues. I feel resistance or drag when removing the stylet from the catheter. If you're pulling the stylet out of the hub at an angle, you may feel a scratching sensation as the steel needle is passing through the safety clip. Stabilize the catheter hub and remove the stylet straight out, parallel to the patient's skin. Once the stylet is out, can't reinsert back into catheter. As per the ideal IV cannula procedure, followed by most of the reputed hospitals, the stylet should never be reinserted into the catheter. If the cannulation has failed in the first attempt, using a fresh cannula is preferred. Reinsertion could cause catheter embolism. Catheter embolism occurs due to blockage of blood vessel by a piece of catheter that has sheared off. This can happen either due to reinsertion of the needle into the catheter against resistance. The severed piece can float freely in the vein, which can be fatal for the patient. However, as the safety metal clip is located in the hub of the catheter, stylet should not be completely withdrawn out until we are sure that the cannula has completely entered the vein. Why do clinicians worldwide prefer B. Braun Safety IVC, Vasofix Safety, and Introcan Safety? B. Braun's safety catheters offer unique protection, which requires no additional step to activate the safety mechanism. A metal safety clip automatically attaches to and covers the tip of the needle as it exits the catheter hub. If you are using a non-safety catheter, the Vasofix Safety requires no change in technique, which means you will require minimal in-service. The catheter and the stylet itself is also very standard size, similar to the non-safety catheter, which means that it doesn't increase the volume in the sharps container, neither it interferes in discarding. B. Braun's safety devices adhere to the principles of the sharp safety devices by the international organizations like the CDC and the US FDA. Mission Safety. You care for patients. We care for you. Be safe. B. Braun. Sharing expertise.